this is a major strike. Has just started. Yet again, workers standing up, fighting back. This has been the year of strikes, hasn't it? The biggest health worker strike in United States history has just begun. 75,000 healthcare workers across nonprofit Kaiser Permanente facilities have walked off the job. On October 4th, 75,000 healthcare workers at Kaiser Permanente facilities in several U.S. states are set to go on strike. So that was yesterday. For 3 days following the breakdown of contract negotiations last week, a coalition of several unions representing health workers in California, Colorado, Oregon, Washington, Virginia, and Washington, D.C. is battling the nonprofit health giant for safe staffing levels, cost of living pay increases, and against a two-tier pay system that Kaiser is trying to introduce. And this two-tier system bullshit is has like it's just infiltrated so many different. This is them walking off the job, the video right there. But it's just infiltrated so many different types of jobs and industries. The reason, again, and I mentioned this before, that they want multi-tier workers is so you're literally getting paid different for the same job, is so that it separates you. It separates the workers. You don't unite. You don't fight together. That's the goal. And if you have 1,000 workers doing the forklift and they're getting paid well, and you have 1,000 workers doing the forklift and they're getting paid shit, well, the ones getting paid shit are less likely to have the ones getting paid well to stand with them. So it divides workers so that they can't fight back together, and obviously saves the higher ups, the top of the industry, a lot of money to be able to exploit people like that. And that's the goal. So this is one of the biggest healthcare strikes in U.S. history, the biggest. The largest union in the coalition is the Service Employees International, SEIU, with 57,000 members, but the coalition also includes office and professional employees, international union, and others. This size of strike is unprecedented in the healthcare field in the U.S. We are in a healthcare staffing crisis, but Kaiser is unwilling to even meet with our bargaining team to discuss a wage proposal that would keep good healthcare workers at our facilities. According to the SEIU, internal debate within Kaiser as to whether to allow workers to strike or to attempt to avoid one has meant that the health giant has been absent from negotiations as of late. The union coalition has accused Kaiser of unfair labor practices and as a result will go on a ULP strike. So this is pretty big. And again, this is part of a year of strikes where workers are realizing their power, realizing their strength. And this is in a country where we have one of the worst healthcare systems in the world. One of the worst that fucking exist anywhere. They just destroy people's lives. Not just, I think still a lot of people think, oh, well, it destroys people's lives if you don't have healthcare. Like, you don't have healthcare and then you can't get the treatment you want and you die from preventable causes or other problems. But the truth is, it's the number one cause of bankruptcy for people that have healthcare coverage. It still bankrupts them. If you get cancer, a study found 50% of everybody who gets cancer, their life savings is wiped out. Whether they survive or not, life savings wiped out, 50%. And 1 out of every 3 people gets cancer. So this is like a system that just wipes out the life savings of a massive percentage of the United States. So, I don't know if they do the studies of how many people had their savings wiped out by healthcare problems and then end up in debt. And now that contributes to this crazy amount of debt, trillions of dollars of debt. What was it? For the first time recently, credit card debt hit $1 trillion. Yeah, here it is. Let me show you this one. Americans' credit card debt tops $1 trillion, hitting all income levels. And that's the first time credit card debt has been over $1 trillion. And $1 trillion is an unbelievable amount of money. And, this article won't tell you, but how much of that is because people put shit on credit cards because they had their savings wiped out by some sort of healthcare problem? I mean, it must be a lot. I'm sure it's a lot. But it's just unbelievable. In the richest country in the land, you're going to just let everyone's lives be destroyed in this egregious system that you can't even get a vote on in Congress. You can't even get the so-called more left-wing president to do shit about it. The best you can get is Obamacare, which was a Republican idea initially. And then the Democrats have joined the Republicans. And so now we have a Republican healthcare system that gets a few more people onto healthcare, but still destroying lives. I almost lived in 4 months ago. We were looking for a new place to live, and we almost moved to New York State, near New York City, and we looked at the healthcare when we were thinking of that move, and for a family, one kid, it was the cheapest one in the marketplace, the cheapest one that even existed that we could find, $1,700 a month. $1,700 a month, and that's without any deductibles that you end up paying or paying for other things that aren't covered. That's if you're healthy. $1,700 a month. That's a fucking rent for a nice apartment. Maybe not a nice apartment, but it's a rent. $1,700 a month. And there was nothing, there were no other options. It wasn't like we were like, oh, well, that's the gold plated. No, that was no plated. There was no plates on that one. Just $1,700 a month. It's fucking pure insanity. If you aren't covered by your job, if they don't pay for healthcare, you are just fucked. Fucked. But you guys already knew that part. Anyway, healthcare workers are striking, obviously not for those reasons. They're striking to get themselves paid appropriately.